Long time no see. This is YouTube Medical University. I have a question for you all. Among lack of exercise, number of cigarettes smoked, and number of teeth, which do you think has the greatest impact on mortality risk? The answer is the number of teeth. According to a large-scale study conducted on elderly people aged 65 and older in Japan, modifiable. Among the risk factors, the number of teeth had the greatest impact on mortality risk. The second was lack of exercise, and the third was the number of cigarettes smoked. In other words, dental health may have a greater impact than exercise or smoking. Think about it. If you lose your teeth, you can't chew. If you can't chew, you can't eat meat or vegetables. Without protein, your muscle strength declines. If your muscle strength declines, you are at risk of falling or becoming bedridden. In other words, teeth are like infrastructure for maintaining a healthy body, just like water pipes or electricity. Normally, you don't think about it, but if it breaks, everything stops. I'm a general practitioner, and I usually focus on internal medicine and look at the whole body. After seeing hundreds of patients in outpatient care, there is one thing I am certain of. People who still have their teeth are healthy no matter how old they get. They can chew and eat what they like at any age. Those kinds of people are able to maintain both their physical strength and their energy. That's why today I want to talk about teeth. In the first part today, I'll talk about what terrible things can happen when your teeth go bad. It's not just diabetes or heart disease. I'll also talk about the chain of chronic inflammation. In the second part, I'll share research challenging the belief that damaged gums can't heal. What happened when people didn't brush their teeth for 3 weeks? In the third part, I'll share 4 research-backed tools to protect your gums. Please watch until the end. First, there's something I want everyone to know. Gum disease isn't just a disease of the teeth. When you have gum disease, chronic inflammation occurs inside your gums. It's like a small fire smoldering in your mouth all the time, and this inflammation spreads throughout your body via the bloodstream. Let's see what happens as a result, one by one. First, let's talk about diabetes. According to a highly reliable Cochrane review published in 2022, which gathered as many as 35 studies just by treating periodontal disease in the teeth, the average value of hemoglobin A1C, which is an indicator of blood sugar levels, dropped by an average of 0.43% over 3 to 4 months. For those who aren't familiar with what a 0.43% drop means, when you add one diabetes medication, the average change in hemoglobin A1C is about 0.4 to 0.9%. In other words, to put it simply, just by treating the gums, you can get an effect equivalent to adding one type of medication. On the other hand, if you leave periodontal disease untreated, even if you're taking medication, its effects might be cancelled out. Next, let's talk about the heart. Several highly reliable meta-analyses have shown that people with periodontal disease have about 1.2 to 4.4 times higher risk of heart disease and vascular blockage. Why is that? The inflammation that occurs in the gums spreads through the bloodstream, and the inflammatory substances themselves damage the blood vessels. A small fire in your mouth, in other words, can spread all the way to your heart, and the same goes for dementia. People with severe periodontal disease have about 2.85 times higher risk of developing Alzheimer's type dementia. This finding also comes from a large-scale analysis involving as many as 4.22 million people. In other words, this means that periodontal disease can spread to the brain and cause inflammation there, and that's not all. It also affects the bones, especially in women who have reached menopause. There have been reports of a connection between periodontal disease and osteoporosis, which causes bones to become brittle. That makes sense, since periodontal disease causes bone loss around teeth, while osteoporosis weakens all your bones. In other words, both are diseases where the bones are being destroyed. So conversely, if you've been diagnosed with osteoporosis, if you've been told your bones are becoming fragile, you should also be careful about periodontal disease. And finally, what I want you to be most careful about is something called aspiration pneumonia. Elderly people should be extra careful about this. Aspiration pneumonia happens when your swallowing ability weakens and bacteria in your saliva or food go into your lungs instead of your esophagus, causing a lung infection. There's an interesting study on this. In Japanese nursing homes, the group that received professional oral care from dentists and dental hygienists had about a 39% lower incidence of pneumonia compared to the group that didn't receive such care. And surprisingly, the mortality rate was also about 50% lower. Aspiration pneumonia can be life-threatening. Just by keeping the mouth clean, you can actually reduce the risk of pneumonia and even death. There's a patient who left a strong impression on me in my outpatient clinic, a man in his 60s. Even though he was being treated for diabetes, his hemoglobin A1C, the average blood sugar level, just wouldn't go down. He was doing his best with his diet and taking his medication properly, and yet his blood sugar just wouldn't improve. So when I asked about the condition of his mouth, he told me that recently his back teeth had become loose, he couldn't chew hard foods anymore, and every time he brushed his teeth, his gums would bleed. When I examined his mouth, I found he had periodontal disease, but since he wasn't in pain, he hadn't mentioned it. I had him see a dentist, and it turned out to be severe periodontal disease. However, 3 months after completing the treatment for periodontal disease, even though nothing had changed with his meals or medication, his hemoglobin A1C, the average value of his blood sugar, gradually started to decrease. Of course, I don't think this will happen to everyone, but as shown in the data from the paper I mentioned earlier, it's highly likely that reducing inflammation in the mouth caused by periodontal disease made it easier for his blood sugar to decrease. If you've listened this far, please remember that periodontal disease is not just a disease that causes teeth to fall out, but it may also harm your whole body as a source of chronic inflammation. Now here's the question. Can that source of inflammation be eliminated, and can damaged gums recover? I'll explain these points. Let's take a short break here. If listening to the first lesson made you realize that gums aren't just a dental issue, that awareness is the first step to protecting your body. If you haven't subscribed to the channel yet, please do so now before you forget instead of just saving it. Also, if you hit the like button, this video will reach more people who have similar dental concerns. Now let's move on to the second lesson. In the first lesson, I talked about the effects of periodontal disease on the whole body. So, for those whose gums are already in bad condition, is it already too late? Let me give you the conclusion first. Some stages allow recovery, while others don't. This is very important, so please listen carefully. Gum disease falls into two main categories. The first is gingivitis. This is when only the surface of the gums is swollen. If we compare it to a fire, it's like a small fire. Since the walls aren't burned, if you put it out, it will return to normal. The second is periodontitis. This is when the bone supporting the teeth has dissolved. It's like the pillars have burned down, so even if you put out the fire, the burned pillars won't return to normal. In other words, whether your gums can recover depends on which stage you're at now, and what's important is knowing the proper care, which is like having a fire extinguisher in case of a fire. I'll talk about this in more detail in the third period, but first let's look at a study that shows whether gingivitis can really be reversed. In 2013, a research team in Germany conducted an experiment with 37 healthy young people. Only on one side of their mouths, they were told to stop brushing their teeth for 21 days. It's quite a bold experiment. So what were the results? In just 21 days, gum bleeding increased by 34%. Even more surprising, it wasn't just in the mouth. Blood tests also revealed higher inflammation markers in the blood vessels. Not brushing teeth for just 3 weeks raised inflammation levels throughout the body. This is exactly what I mentioned in the first lecture, the fire in the mouth spreading through the body. But there's more to the story. In this study, after suspending toothbrushing for 21 days, they had the participants start brushing again. Then, after another 21 days, both the bleeding of the gums and the markers of inflammation in the blood returned to their original levels. If it's at the stage of gingivitis, with proper care, the gums can recover. The inflammation throughout the body will also subside. This is the basis for saying that you should restore your gums before the damage becomes irreversible. Just like in the previous example, if there's bleeding from your gums, it's easy to notice, right? However, not all cases of periodontal disease involve bleeding, and often there's no pain either. Let's do a self-check here. I'm going to explain 8 items now, so please check how many apply to you. First, stickiness in your mouth in the morning. Second, bleeding when brushing your teeth. Third, bad breath. Fourth, redness or swelling of the gums. Fifth, receding gums. Sixth, the gaps between your teeth have widened. Seventh, it's hard to chew tough foods. Eighth, your teeth feel loose. These are signs of periodontal disease listed by the Ministry of Health, Labor and Welfare's eHealthNet. If even one of these applies to you, you are at risk. But please don't panic. Everyone gets to the starting line from the moment they become aware. If you delay seeing the dentist until things worsen, your bone may dissolve and your gums won't return. So specifically, what should we do to avoid getting periodontal disease or gingivitis in the first place? It's best not to get them at all, right? In the third period, I'll introduce 4 tools to protect your gums based on data. From here on, this is the practical section. What exactly should you do? I'll introduce 4 tools, all based on research data. First, this is what I wanted to tell you the most today. That is the interdental brush. You might be wondering, not a toothbrush, but an interdental brush? Of course, a toothbrush is important, but there are places it just can't reach. Picture it this way. A toothbrush is like cleaning the main street, removing debris from the surface of your teeth. However, the alley-like spaces between your teeth are hard to clean with just a toothbrush. In those hard-to-reach areas between teeth, bacteria can build up and cause inflammation. In a 2016 study conducted in France, 46 patients with gingivitis were divided into 2 groups. One group used both a toothbrush and an interdental brush, while the other group used only a toothbrush. As a result, in the group that added the interdental brush, bleeding from between the teeth dropped dramatically from 36% to about 10%. On the other hand, in the group that used only a toothbrush, bleeding from between the teeth was originally 34.8%, and after 3 months it was 37.6%, showing almost no change. In fact, it even increased a little. So just using a toothbrush alone can't suppress inflammation between the teeth. By adding an interdental brush once a day, even just that much can lower the risk of bleeding. You might think it's a hassle, but please try to use it once a day, for example before brushing your teeth at night. Use an interdental brush whenever it suits you, even just 30 seconds or a minute is enough. This small habit will help protect your gums in the future. It can help prevent the worsening of diabetes, lower the risk of heart disease, and may even help prevent dementia. The second tool is the electric toothbrush. You might wonder if regular brushing is enough. Brushing by hand can be effective enough if you do it the right way. However, brushing correctly is actually quite difficult. According to a highly reliable paper called a meta-analysis, which summarizes multiple studies, about 72% of people who used electric toothbrushes ended up with healthy gums, while only 21% of those who brushed by hand achieved healthy gums. That's a 3.4-fold difference. The electric toothbrush brushes faster and more consistently than you can by hand, especially if you lack dexterity. For elderly people who may not be able to move their hands as quickly, the electric toothbrush becomes a powerful tool. The third tool is dental maintenance. Even if you get a cavity or finish treatment for periodontal disease, I recommend getting a professional checkup and screening at least once a season, or at the very least, once a year. According to a systematic review, according to a highly reliable study, people who receive regular dental maintenance have about a 26% lower risk of losing their teeth compared to those who don't. I think many people believe that you only go to the dentist when your teeth hurt, but periodontal disease doesn't hurt in the first place, right? If you wait until it hurts, it's already too late. So it's very important to visit the dentist regularly to have tartar and dirt removed, to check for small cavities, and to see if you have any signs of periodontal disease. And now, the fourth and final tool. This one is a bit different as it relates to your whole body. What do you think is the biggest risk factor that worsens periodontal disease? It's smoking and diabetes. Actually, smoking reduces blood flow to the gums, lowers your immune strength, and makes healing more difficult. Even if you brush your teeth thoroughly, if you smoke, it's said that the effects are cut in half. As for diabetes, it's just as I explained in the first session. Diabetes makes periodontal disease worse, and periodontal disease itself also makes diabetes worse. To prevent this kind of vicious cycle, it's important to control your blood sugar while also making sure to have regular dental checkups. In other words, protecting your gums means reducing inflammation throughout your body by cutting down on smoking and controlling your blood sugar. It's clear now that this isn't just a dental problem. If you think it's too late because you already have periodontal disease, even with periodontal disease, you can still stop it from getting worse. It's also important to focus on taking care of the teeth you have now. And nowadays, regenerative treatments like periodontal tissue reconstruction are being actively performed, so please don't give up thinking it's too late. First, please consult your local dentist to find out the condition of your gums and what kind of brushing is recommended for you. Often, it's too late once symptoms appear. So, here's a summary of today's talk. First point, periodontal disease is not just a disease of the teeth. It can worsen diabetes and be linked to heart disease. dementia, osteoporosis, and aspiration pneumonia. It's a source of chronic inflammation that affects the whole body. Second point, if it's still at the gingivitis stage, your gums can recover. But if you ignore bleeding, 30% of cases will get worse. Thinking it's fine because it doesn't hurt is the most dangerous. Third point, 4 tools to protect your gums: regular toothbrush, interdental brush, electric toothbrush, regular maintenance, and managing inflammation throughout your body. As I mentioned at the beginning, teeth are the infrastructure of your body. When you reach your 80s or 90s, you'll want to be able to chew and eat what you like with your own teeth. By doing that, you get enough protein, maintain muscle strength, and enjoy delicious food that lifts your spirits. You don't need any major work to protect this infrastructure. Just use an interdental brush once during your nightly brushing and make an appointment with your dentist. If you smoke, try reducing the number of cigarettes you have, or consider quitting altogether. Anything is fine. Even a small step now will make a difference 10 years from now. In 20 years, it will change your future. Please share in the comments what you are mindful of, what you will start working on from today, what you learned, or anything that surprised you. Even just a word would make me really happy. Well then, that's the end of today's lesson. Take care of yourself, and I'll see you in the next video.